As science continues to deepen our understanding of addiction, we are moving closer to a future where treatment is not only more effective but also more personalized. The growing field of genetic research and biotechnology is transforming how addiction is understood, diagnosed, and managed. By identifying the genetic factors that contribute to substance use disorders, healthcare providers are beginning to shift from generic one-size-fits-all approaches to more targeted, individualized strategies. This transformation holds immense promise for prevention, early intervention, and recovery support. One of the most exciting developments in addiction science is the use of genetic testing to identify risk. Although we are still in the early stages of fully integrating this into clinical practice, the ability to screen for certain genetic markers can help flag individuals who may be at elevated risk of developing substance use disorders. For example, tests may reveal variants in genes that affect dopamine receptors, opioid receptors, or serotonin transporters, all of which can influence how a person responds to substances. These insights can be especially valuable for young people with a family history of addiction, helping parents, schools, and healthcare providers implement early and preventive strategies. In clinical settings, understanding a patient's genetic risk profile can also help doctors make informed decisions. If someone is known to be highly sensitive to opioids, for instance, non-opioid alternatives might be prioritized for pain management to reduce the risk of dependency. Similarly, individuals who metabolize alcohol or other substances differently may require customized support to avoid complications or heightened addictive potential. Genetic research is also revolutionizing the treatment landscape. The field of pharmacogenomics, which studies how genes affect a person's response to medications, is allowing doctors to tailor addiction treatments in ways that were never before possible. This is especially valuable when treating complex cases involving co-occurring mental conditions, which often require precise medication management. For example, some individuals respond better to naltrexone, a medication used to reduce cravings for alcohol and opioids, if they carry a specific variant of the OPRM1 gene. Those with genetic profiles indicating faster metabolism of medications may require adjusted closing schedules to maintain effectiveness. Medications for nicotine addiction, such as bupropion or varenicline, may have variable success depending on the person's genetic makeup. Beyond medication, genetic insights can also inform behavioral therapy approaches. Someone with a genetic predisposition toward anxiety or impulsivity may benefit from a treatment plan that includes trauma-informed therapy, mindfulness-based interventions, or emotional regulation training, alongside traditional recovery strategies. The scientific community is rapidly uncovering more about the genetic architecture of addiction. Genome-wide association studies, which scan large populations for patterns in DNA, have already identified dozens of genetic variants linked to different forms of addiction. As this research matures, it will likely reveal not just single risk factors, but complex combinations of genes that interact with each other and with environmental variables to shape behavior and brain function. In the future, we may be able to develop predictive algorithms that combine genetic, psychological, and environmental data to assess addiction risk with remarkable precision. This could lead to proactive, preventative health strategies that begin in childhood or adolescence, long before substance use begins. There is also potential for new therapies based on genetic insights, such as treatments that target specific brain pathways with high precision, or even gene editing technologies that one day might correct biological vulnerabilities before they express as disease. Though such advances are still years away, the trajectory is clear. Addiction treatment is becoming more informed by science, more tailored to the individual, and more effective in addressing the root causes of the disorder. What emerges from this genetic revolution is a new way of thinking about addiction, one that replaces blame with biology, stigma with science, and generic treatment with customized care. While genes are not destiny, understanding them gives us powerful tools to shape outcomes and improve lives. As research continues to unravel the intricate web between genetics and addiction, the pathway forward becomes one of greater perception, deeper compassion, and lasting recovery.